Hi, we're going to talk a little bit about the heart. The heart plays a huge role in maintaining homeostasis and keeping you alive. The average heart beats approximately 100,000 times in one day and 35 million times per year. The heart is one of the first things that begins to work in a developing baby. The first cells beat at as early as 4 weeks. Now let's get into the anatomy. There are three outer layers covering the heart. The epicardium is the outermost layer, the myocardium is the middle layer, and the endocardium is the innermost layer. In the base of the heart, you can find the aorta. The aorta is the large artery that carries oxygen-rich blood from the left ventricle of the heart to other parts of the body. Next, you can find the superior and inferior vena cava. The superior vena cava is the large vein which returns blood to the heart from the head, neck, and both upper limbs. The inferior vena cava returns blood to the heart from the lower part of the body. The pulmonary trunk is a major vessel of the human heart that originates from the right ventricle. It branches into the right and left pulmonary arteries, which lead to the lungs. Now looking at the pulmonary arteries, they carry deoxygenated blood from the heart to the lungs. They are some of the only arteries that carry deoxygenated blood. The base of the heart contains all of the important blood vessels that send the blood away from and towards the heart. A good way to tell them apart in pictures is that the arteries which send blood away from the heart are red and the veins that send blood towards the heart are blue. Within the heart, there are parts such as atria, ventricles, AV valves, and semilunar valves that work together to send blood throughout the body. Keep in mind that the left atria and ventricle are much larger and thicker than the right because they are important in systematic circulation, meaning they send blood throughout the entire body.
Blood enters the heart through the two atria and exits through the two ventricles. Deoxygenated blood enters the right atrium through the inferior and superior vena cava. The right side of the heart then pumps this deoxygenated blood into pulmonary veins around the lungs. AV valves, which separate the atria from the ventricles, allow blood to flow from the atria to the ventricles, but prevent flow in the opposite direction. The right AV valve is called the tricuspid valve. The left AV valve is called the mitral valve. Semilunar valves act to prevent backflow of the blood from the arteries to the ventricles during ventricular diastole and to help maintain pressure on the major arteries. Now let's look at all these parts in the sheep's heart. So this is the sheep heart. First thing you're going to want to do is get rid of the pericardium using some pair of scissors. Make sure you're not nicking any arteries or any parts of the heart, especially around the base because it's pretty tight around there. After it's off, it's going to look like this. You're going to want to take off the fat that's surrounding the heart, especially around the base, because it covers up most of the important vessels and parts of the heart. And then after you take off the fat, you're going to have some arteries exposed, like the coronary artery right here and a little bit over there. I also got rid of some of the fat around the base to expose some of the most important vessels. This is a little tip. If you want to know which vessel is which, use a probe and then probe it through the selected vessel. As you can see here, I selected this one, and it goes through the right atrium, so it's the pulmonary trunk. Over here is the superior inferior vena cava. So superior inferior, this is posterior view, superior inferior, and this is the auricle, one of the auricles, and then the pulmonary vein right there. As you can see, because you poke it through, it goes through the left atrium. And then, so first incision is so you can see the right atrium. So you just take a pair of scissors, you cut through the superior vena cava, whether it's from superior to inferior or from inferior to superior, and you cut it along the probe, as you can see. And then you open it up. As you can see, there's the right atrium and the tricuspid valve. You're going to have to pour in some water so that you can see how it functions. So over here I'm pouring in some water, and it closes like a trapdoor. And then the next cut is going to be through the pulmonary trunk, as you can see. valve. It's a little bit different on everybody's heart, but of course you can tell by probing the thing through and seeing where it goes. So then you cut through it. Over here you're going to see the semilunar valve, which functions a little bit differently than the AV valve, like the tricuspid and mitral valve. So you pour water in here to see how it functions. Over here, we're extending the cut so that we can expose the right atrium. So just takes a pair of scissors and then cut through it. You just go down a little bit, make it look kind of like a flap. As you can see here is the moderator band and the tricuspid valve with the chordae tendineae that attach to it so that, it doesn't fall off and it functions right. Then that was the myocardium. I exposed it a little bit more, the tricuspid, and you're going to use a scalpel over here to expose the left atrium. You're going to have to be a little careful with it because it's very tough, tougher than the right atrium. So you're going to have to be careful with the scalpel because it might break. You can see here, I exposed the left atrium, and you can see the mitral or bicuspid valve with the chordae tendineae. And it's thicker usually because it's important for systemic circulation. So see the thickness at the left atrium, and then over here see the thickness of the right atrium. Very different.
Of course, there are many diseases that can affect the heart. One of the most serious and common diseases is coronary artery disease. This happens when the arteries that supply blood to the heart muscle become hardened and narrow. This is an effect of a buildup of cholesterol and plaque on the inner walls. This buildup is called atherosclerosis. As it progresses, less blood is able to flow through the arteries. As a result, the heart muscle can't get the blood or oxygen it needs. All of this buildup can also lead to angina, which is another name for chest pain, or even a heart attack. Most heart attacks happen when a blood clot suddenly cuts off the heart's blood supply, causing permanent heart damage. Over time, coronary artery disease can also weaken the heart muscle and contribute to heart failure. Heart failure means that the heart cannot pump blood well enough to the rest of the body, or arrhythmias. Arrhythmias are changes in the normal beating rhythm of the heart.
Another very common problem with the heart is hypertension or high blood pressure. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. With blood pressure, the long-term force of the blood against your artery walls is high enough that it may eventually cause heart problems such as heart disease.
One less common disease is congenital heart disease. Congenital heart disease is an abnormality in your heart structure that you are born with. There is no set cause, but it is most likely an effect of drug or alcohol abuse during pregnancy, problems in genes or chromosomes, or viral infection. There are several different types. One is a heart valve defect. A heart valve may be too narrow or completely closed, so blood has a hard time getting through or can't get through at all. A valve might not close properly, so the blood might leak backwards. Another could be problems with the heart's walls, such as those between the chambers of the heart. Holes or passageways between the left and right side of the heart might cause the blood to mix together when it shouldn't. And lastly, bad connections between certain blood vessels. In babies, this may let blood that should go to the lungs to get oxygen go to other parts of the body instead, or vice versa. These defects can lead to heart failure.
The heart is a fascinating and essential organ to our well-being. We hoped you learned a little bit about the heart and enjoyed our video.